So this is going to be a video to discuss some of the more common musculoskeletal imbalances within the body. And these are, again, common because they reflect the kind of current human condition of frequently sitting in chairs or working on computers. So the major imbalances that we see are a tightness in the front of the body. So within the chest, particularly in the hip flexors, in the quadriceps. And this is from always sitting in this position, and also from, tension that we carry in our neck and our posture. So head forward, working on computers. And then conversely, we tend to see weakness in the back of the body. So particularly between the shoulder blades, the rhomboid areas. We don't have enough strength in the upper back to really hold ourselves upright. And also weakness in the hamstrings and weakness in the glutes. Another common area of imbalance is within the pelvis itself. Let's see, I was going to read you. This is actually, I wrote a little handout for a workshop that I did last year on yoga for common muscular imbalances. So these are actually my own words. So speaking particularly about the lower body, the more common imbalance is in the lower body. In elevated pelvis, the pelvis is a little higher on one side. This can be due frequently to carrying a baby on one hip, or always positioning yourself in a way that one hip is higher than the other. A rotated pelvis, where the pelvis is tilted a little bit forward on one side. This can be related to some sacroiliac dysfunction. And a tilted pelvis, where the pelvis more commonly anterior tilts, but we can see it the other way, posterior tilt. And we'll break that down a little bit. Self-awareness is helpful because, just being aware of those imbalances that you might see within your own body can help you self-correct a little bit better. So going back to the anterior tilted pelvis, this is, again, related often to maybe some structural imbalances, but also to frequent sitting or to prior pregnancies, where we're kind of used to the belly being bigger and the pelvis is almost forced to be anterior tilted, or overweight, where the belly is bigger and the pelvis tilts forward. With an anterior tilted pelvis, the hip flexors, the psoas, and often the quads in the front of the body are short, and the hamstrings in the back of the body are long. This, speaking of muscle groups as short and long, is common in physical therapy, I believe. I kind of picked up on that terminology after doing some reading from Dr. I think it's Lee Albert. He is out of Kripalu. He was the yoga teacher or the anatomy teacher for one of my friends that did teacher training there. I know I wrote it down on the back of one of these pages. I just don't want to misquote his name and his credentials. Okay. Anyhow, he is at the Kripalu Center, and he's also a positional therapist. He actually had some significant imbalances, maybe from a car accident, that led him down this road of healing for himself and for others. But his book is where I picked up on that talk of muscles being short or long. Yes, it is Lee Albert. And he's a neuromuscular therapist. So I really think he's only written 1 or 2 books. I should have written down the name of the book, but I picked it up on Amazon. And if you're interested in this particular topic, he really breaks down practices for the upper body, for the lower body, and really does a great job at it. A good, wonderful healer. My friend, actually, that same friend that did her teacher training at Krupalo, also went to Krupalo pretty frequently, and after a surgery, she had some significant imbalances within her pelvis, and he was able to basically identify it quickly, and with that positional therapy, bring her back into balance, I think with 1 session. So pretty amazing anatomist, but then he can bring that out into healing as well. So I digress a little bit, but I wanted to make sure I gave him the credit that was due for some of the inspiration for this work. I've been teaching a Happy Bat type class for 6 to 8 years, I guess, and his line of reasoning is sort of what I based my class off of before I even read his book. So it's not a new concept that we need to strengthen the back of the body and stretch the front. So I wanted to finish that sentence because I thought it was kind of cool. So he says, again, that I like his languaging. The front of the body, the muscles are short, and the back of the body, the muscles are long, which means they need to be strengthened up. And this is a good example of a muscle group being long and feeling tight. A common mistake in yoga and other fitness programs is that the hamstrings feel tight and they're overly stretched. In reality, the hamstrings and the glutes need to be strengthened in poses such as bridge and locust. The psoas and quads need to be stretched in poses such as lunges, dancer pose, hero pose, camel variations. So, again, it's all about balance. Another common, I won't say misalignment, but imbalance is between the inner and the outer thighs. So the inner thighs tend to be on the weaker side and need to be strengthened rather than stretched. And the outer thighs need to be stretched. And that's in a general sense. A common misalignment within our feet can exacerbate that. People that tend to put their toes out can have weakness in the inner thighs, tightness in the outer thighs, but that can be a general issue. So when we have these imbalances within the musculature, they can create pain patterns, such as obviously low back pain, because the muscles and the pelvis are out of alignment. So simply doing a targeted yoga practice can help over time bring things back in line, as well as for the upper body, that head forward posture, we want to bring it back. Another misalignment that we sometimes see in the upper body is the head can be tilted ever so slightly to one side or the other, which could lead to chronic tightness on one side. So just being aware, again, of that imbalance within yourself, maybe in your students or others, to even things out. Other ways to address that are things like shoulder shrugs and strengthening this area, strengthening the back of the neck in poses like cobra and locust, where we're not trying to extend too far, we're tucking the chin and working that whole back of the neck. That can be really helpful, as well as some nice deep stretches to the area and finding that good alignment. Sometimes we're just not aware of our alignment, so finding the head right over the shoulders, oh dear, and then finding the pelvis right over the shoulders, the knees, and the feet. So finding that plumb line of alignment all the way down the body can be helpful. And if the head is chronically forward, it's going to take a while to bring it back, or even to just halt it from going forward anymore. Other things to work on that are stretching the chest. So again, if we're forward, we can have tightness in the chest. Other ways to stretch the chest are poses such as, what's the name of it? Where we lie on a bolster and just kind of open the chest like this, or fish pose. That's what I was trying to think of, a fish pose variation. A straight on fish pose where the head goes all the way back can be a challenge for a lot of folks, particularly if someone already has some imbalances. So just that simple towel roll behind the shoulder blades, and either the long way, well, either way is going to help create that opening back there. Stretching our chest, even just coming to a wall, bringing your hand back and stretching the chest. Our open-hearted twist creates a stretch in the chest. Yoga mudra, where we clasp the hands back behind us, that's actually shoulder flexion. We tend to do way more shoulder extension in our practice, so remembering to bring things back and doing yoga mudra in poses such as warrior, just mountain pose, to encourage those shoulders to move back and to stretch open. What else? So these are, again, common misalignments. So you'll see in the video that I created that there are some poses that I purposely omitted and some poses that I purposely brought in. So anytime for ourselves, for our students, we want to think about, why are we doing a pose? Are we trying to open the front of the body? Are we trying to stretch a certain muscle group, strengthen a certain muscle group? And then when we find what we need personally for balance, or what our students need personally for balance, then we get creative as to how we offer that. So the poses that I omitted in the practice are really any poses where we're kind of closing down on ourselves, because again, we're trying to create that stretch, that openness in the front of the body. So avoiding downward facing dog. Downward facing dog is a great kind of neutralizing pose if we're, again, doing it with the right intention of lengthening the spine. Some people really feel that they've got to get those legs straight, and then they're stretching into the hamstrings, maybe overstretching into the hamstrings, that actually need to be strengthened as opposed to stretched for most populations. And also, if we don't have the right strength or flexibility in that position, we can kind of be crunching in on our bodies in downward facing dog. So particularly for someone that has a lot of muscular imbalances, it's helpful for the program to be very targeted and only include poses that are going to bring them into balance. The other poses I omitted for the most part was forward folds. Again, folding forward, stretching the back end of the body, as opposed to strengthening the back end of the body. So to stretch the back body, to strengthen the back body, we want to do more poses like back bends. All kinds of back bends. They don't have to be extreme. It could be cobra, it could be locust, it could be bridge. All of those types of back bends. Super helpful for bringing balance to not just the upper body, but also the lower body, where we're targeting those rhomboids and also targeting the hamstrings and targeting the glutes a bit. And then one other pose group that I purposely omitted is seated poses. Because again, we're trying to move away from the habitual human nature of sitting. There are certainly benefits and merits to seated poses of opening our hips, but for this particular practice, or if I'm working with a population that I know has a lot of these imbalances, I might do very little in seated. Part of the reason for that is sometimes I find people are unwilling, I guess, to prop appropriately. So if you're not propped appropriately, then you're going to create that flattening in the low back, and you're not creating the nice normal curves of the low back that promote spine health. So if we're dumping into the low back in our seated poses, we're not really intelligently working into the areas appropriately. And I find there's so much work that we can do on our yoga mat lying down, either on our back or prone on our belly, that seated, we can omit that if need be. What else? Oh, another pose group that I didn't talk about that is super important for creating balance within the body is our lateral side bends. So lateral side bends, any variation of them, are going to stretch into the QL, the low back area. It creates balance in the upper body as well as the lower body. And it can even create that stretch down through the IT band. So stretching the whole outer edge of the leg all the way up the side, making space in the intercostals, and then a little gentle stretch of the neck. So really important poses to bring balance. It's also a pose where we can notice some imbalances, such as scoliosis. If someone has even a mild scoliosis, they might find that they can laterally bend really easily in one direction, and the other direction they're super, super tight. And that can be a sign of scoliosis. So we want to try to encourage the stretch on the side that's tight. So sometimes for that population, you might suggest that they don't omit the side that's looser, but do 2 rounds on the side that's tighter to encourage that balance. And there's lots of ways to bring that in. What else? So again, this is just a way to come back to this idea that our yoga practice is for balance. We admit it, oftentimes we start with the body, awareness of what might be imbalanced in the body, and working towards that. And that can lead into more and more layers of awareness. Awareness of the breath, awareness of just bringing your attention into one side of the body more than the other. That can be a sign of an imbalance. Particularly good place to notice that might be even just in mountain pose. Are you standing with more weight in one foot than the other? But again, starting with the body, then it can bring in the breath, the mind, the heart. Layers and layers of awareness to bring balance. I was talking with a friend today about balance and giving ourselves permission to not be in balance. So getting off of the whole body idea. And it could be body, like, geez, wow, I haven't done, my yoga or walking in a couple of weeks, and why, and how is that affecting me? So obviously the body is a great indicator. Or I'm having that pain again that I get in my hips or my neck when I'm stressed. But also in the ways we speak to ourselves, judgments, and allowing ourselves to be how we are, knowing that these feelings, these thoughts they will pass and they don't really define us. So coming back once again to the very roots of yoga philosophy, that we are spirit having a human experience, and that means we have bodies to attend to, and we also have thoughts, emotions, families, jobs to attend to. So approaching it with openness, awareness, and kindness. So, and that box full of tools, so we know where to go when we feel off balance. So looping you full circle from the body back to the mind and some of the other pieces of yoga philosophy. So just making sure I touched on everything. So just looping right back to the beginning when he was talking when Lee Albert is talking about short and long muscles. I'll just read you a bit from actually the first paragraph of my handout. I'm just going to read it to you. Daily living that keeps us moving in one plane. We didn't even talk about this, and this is an important point. The coronal plane moving straight ahead, as well as a habitual pattern such as sitting in chairs, leads to muscular imbalances that can lead to pain. These imbalances can even pull the skeletal system out of alignment, leading to problems with the vertebral discs, nerve impingement, tight fascia, and other medical conditions. In a general sense, muscle groups work in pairs between the front and the back of the body and the two sides of the hips. When the body is out of balance, one of the paired groups of muscles tends to be short, and the other paired group tends to be long. Both long and short muscles can feel tight, but physiologically, short muscles are tighter and need to be stretched more. Long muscles, like those hamstrings, need to be strengthened. So when we think of our lifestyle, frequent sitting and often putting ourselves in a head forward posture, it should be no surprise that the muscles in the back of the body tend to be long and weaker, whereas the muscles in the front tend to be short and tight. So, balance. Knowing why we're doing yoga. So much more important than just doing it without the intention weaved in behind it, whether it be the physical intention to bring balance or the mental or spiritual intention to bring balance, whatever that means to you. Thank you for your time. Reach out with any questions.